I'd like to talk to you about psychiatry. Psychiatry is like any other medical practice, except they're dealing with the brain, more precisely, thought and emotion and behavior. They're not brain surgeons, but I bet they'd like to be. Meanwhile, um, what it is all about is that you stay at the hospital like a normal human being who's sick. They keep you under close supervision so you don't get into trouble and hurt yourself or hurt other people. And they observe you to figure out what you have. When they figure out what you have and you're certain about it, you will be given your full medication correctly. While you're staying there, you will eat like a normal human being. They have you have your regular meals, and you go through a thing called occupational therapy. And really, that's just a lot of cognitive behavioral therapy in action. Then they have music therapy, which is more or less teaching you how to be in tune with your emotions, from the gist of it. I've been there, I know. And then you have group therapy, which is much like what I'm doing here, except you learn from other people what they do and how they are and what they have done and how they feel. And then you learn to pick up with that for yourself, just like you have stuff to offer them for your own experience. And you gain insight on a lot of stuff, and hopefully you gain insight on your mental illness. If you're unaware that you're sick, you're in denial automatically. If you think there's nothing wrong with you, and you fail to realize that what you're doing is odd, then you are sick indeed because you are in denial or just don't know. So realize that you're sick and do something about it. It shows to the doctors that you're quite on the ball and you're not that far gone. If you can realize you're sick and you can ask them for help to help you out with it. For the most part, I talked about OCD. Now I talk to you about schizoaffective disorder. Schizoaffective disorder is delusions, beliefs that couldn't possibly be true, unrealistic beliefs, and hallucinations, whether they be what you hear, or what you see, or even feel, or even smell. The difference between schizophrenic delusions and hallucinations and OCD is that with OCD, you can tell what you're doing isn't real. You can tell it doesn't make sense. Either you think it's normal for you to be that way, or you can tell it doesn't make sense. When you think about it, does anyone ever really worry as much as you do about one thing only? And with delusions, do you believe that you are actually a god or something? You actually believe you're that special that people are out to get you? Do you actually believe what you are hearing is real? Voices coming from nowhere? Nobody experiences that for real. It's never happened for real, except in biblical proportions. In the Bible, back then. Not now. It doesn't happen now. If it does, you better believe more than one person, you, will experience it. Look at all the people that experienced God's voice. They weren't just one person. So if you're Christian and you are schizophrenic, believe you me, you don't hear voices that no one else hears. Best, everyone else hears it. If not, you're on your own, schizophrenically. Visions, hallucinations, get pissed off, but it's the truth. And mania, feeling really hyper happy, and then depression, getting really, really sad. All that I teach can help you deal with it. Depending on how badly you want your health, is how badly you'll use what I teach to deal with it. Now you might want to learn things a lot quicker by challenging the internal meaning that you give things, internal meaning to external behaviors that you believe to be one way, but is different than the other. What I'm talking about is limiting beliefs. Limiting beliefs are things that you believe that are fears and frustrations that hinder you and stop you from proceeding in life. And all you have to do is challenge the internal meaning that you assign your belief, and the external behavior becomes a new, different idea, a new, different approach. Just challenge the internal meaning to a belief that you have, and you can find a whole bunch of different ways of thinking about things. Just challenge it. Challenge the internal meaning you assign to external behaviors, and you will find other things to believe in besides what limited you. I can't really go into deep, profound explanation about it, but that's the gist of it. Psychologists call that reframing, and they do it all the time when you're with them. But I don't reframe people, really. I just teach. That's all I do is teach. And it's up to you to use it.